So let's pick up where we left off. I did modify this PowerPoint since that last recording because I realized it was confusing. So just be aware that immunomodulators and immunosuppressants are two terms that are used interchangeably. In your book, in your Pearson book, on page 703, it talks about medications for inflammatory bowel disease, and the term that they use in the book is immunosuppressant. So just don't get too confused on that. We do also give antidiarrheals if needed. The most common one for that would probably be loperamide. Nutritional therapy is aimed at making sure that they get enough nutrition and also that they're not eating things that are going to make their stomach even more upset. So especially if they're in an exacerbation. So think about things that irritate the GI system, like stuff like lactose, which is hard to digest, or caffeine and alcohol, fatty foods, fried foods. Those things are really hard on the digestive system, so we should avoid those things when they're in an exacerbation. Also, real heavy meals are, that's going to probably make them feel worse. If they're not able to get enough nutrition through their diet, then they might need some TPN, which stands for Total Parental Nutrition. Has some lipids in it, some dextrose, some protein, and vitamins and minerals. So it's a good supplement if they're not able to eat enough. But it's also something that we may give if we're giving their bowels time to rest. So if they're in PO, we're probably going to need to put them on some TPN. So make sure you review the skill on TPN administration. This is going to be going through a large vein, so it's probably going to go through a port in their chest or maybe through a central line in their neck. We're going to probably need to monitor their blood glucose level because of all of that sugar that's in the TPN. And just know that you cannot stop TPN really for any reason. And if you do have to stop it, or you run out, then you need to at least hang D5 to D10 so that they don't go into a rebound hypoglycemia. We're also going to be giving them supplements. And then our most extreme measure would be to perform surgery. So this is the most invasive thing. So we talked about these complications. Obstruction can happen if there's a lot of scar tissue in the bowel and the bowel starts to stick to itself. We talked about fistulas. Abscesses can occur if there are ulcers and fissures in the bowel and they become infected. But also these fistulas can lead to abscesses too. And then malabsorption and colon cancer is a risk factor for these patients. So these are some of the surgeries that we may do. A strictureplasty is when we make a longitudinal incision in the bowel, and that's for an area that may be very narrowed because of scarring, and we're trying to preserve the bowel as much as possible, so we may do that. We may do a bowel resection, which is where we just removed one portion of diseased bowel, like here. And we may do that and they may end up with a temporary ostomy. And then later, once the bowel is healed, we'll go back in and reattach it. So it'll look kind of like this. So it'll just be shortened. A colectomy is really the most extreme surgery that we would do, and that's when we remove the entire colon. So they're going to end up with an ileostomy at that point. If somebody has ulcerative colitis and we remove that entire colon, essentially we've cured the ulcerative colitis because there's no more colon to, have ulcerative colitis. But this is a very extreme measure and it comes with its own set of problems. This is not ever going to be a first resort for us because if you think about it, you absorb a lot of water in this large intestine. So if we remove the entire thing, then this person is going to be at a lifelong risk of fluid volume deficit. And we're really going to have to make sure that they're getting enough fluid. Also, you absorb a lot of nutrients in this large bowel, so for the rest of your life, you're going to have to be on a lot of supplements to make up for that. So it comes with its own set of problems. And then if you don't remember ostomy care, which is something I think you went over in 170 probably, that is something that you need to review, because that is something that you know, are probably going to have to deal with at some point if these patients have surgery. So make sure that you do your readings and come to class with any questions that you have, anything that you want clarified or want to go over a little bit more. And I'll see you guys later.